Hello everyone, my name is Dr. Aditya Gupta. So in this video, I wanted to talk about the subject that's closest to me, that is pediatrics. So how do you study pediatrics? And I will be covering both during undergraduation and during post-graduation. So anyone who's a resident right now will also find this video useful. I'll start with undergraduation. So during your MBBS, pediatrics is rather not an easy subject, but not as tough as, let's say, surgery. The surgery is huge. Medicine seems huge. Pediatrics seems a bit more concise. And I think the credit goes only to the fact that the book is written in a way, Ghai is written in a way that is actually concise. So the simple recommendation is theory you have to do from Ghai. There is no doubt about that. Ghai is a good book. It's a brilliantly written book, and in fact for certain portions of ghai you can actually do medicine also. For example, hematology and oncology is given such so well in ghai that even it covers major portion of your medicine as well. Same is valid for nephrology as well. In my opinion, nephrotic syndrome is given much more better in ghai rather than being given in harrison, for that matter, especially after undergraduate exam is considered. I'm not talking about in general actually. So you have to study Ghai. There is absolutely no doubt about that. The problem actually comes is that a lot of people tend to ask, sir, practicals kaise attempt kare? How do we go about practicals? Now, as far as practicals is concerned, no, the simple thing is that a lot of people do it just from Hutchinson or McLeod's or whatever book that they have. Some people use Meherban saying, I'll actually say there's a book, थोड़ी मोटी है यार, but worth the effort है. देख सकते हो, ले सकते हो, तो I'll actually say it's a really good book. It helped me during my post graduation, and definitely it's much more better resource as far as undergraduation is concerned. It's called as Scott Pediatrics. I think you might know. I don't know whether you know about this book or not. So the good thing about the Scott Pediatrics is actually कि इसमें ना exam point of view से cases दिए हुए हैं. कि let's say a child with fever with hepatosplenomegaly, approach to a Down syndrome child, टीबी, जो टिपिकल तुम्हारे एग्जाम केसेस होंगे ना, उनके बारे में बताया हुआ है. So in such a scenario, I think Scott Pediatrics is a really good book as far as practicals is concerned. So that is one recommendation I think a lot of people don't know about, or in case you do, great. I'm sorry that I'm recommending you something you already know about. So as far as theory is concerned, it's Ghai, and as far as practical book is concerned, I think Scott Pediatrics is a better book. The one more thing I'll recommend is as far as infections is concerned, specifically infections is concerned, be it your especially the childhood infections, the diphtheria, the pertussis, the tetanus. I genuinely believe they're given better in Park rather than being given better in either Ghai or Harrison, for that matter. So if you had read thoroughly during your pediatric and preventive and social medicine, the PSM, in your third year, I think that would be a much better resource as far as for your infection part is considered in pediatrics. Now coming to the postgraduates. Now postgraduates, you have a lot of resources. Now you will be confused, and especially if you want to prepare for NEET SS, then you'll definitely get confused. I mean, how do you go about it? What to do, what not to do, and things like that. So I'll start with the first. Nelson is the basics. I mean, there's no doubt about that. For anything and everything, Nelson is like, it's like Harrison. Better than Harrison. I actually think Nelson is a much better written book as compared to Harrison. But so Nelson to karni hai. There's no doubt about that. A lot of people tend to prefer PG textbook of pediatrics. I think some topics of PG textbooks of pediatrics by Dr. Piyush Gupta are written very well, but some are not just up to the standard. So Nelson is the gold standard, and you have to do Nelson. Apart from that, now I'll divide systematically, system wise, some specific books which you can consider as far as your preparation for your MD exit exam is considered, or your NEET SS is considered, NEET SS or INI CT is considered. I'll start with I'll start with my specialty, that is pediatric oncology and hematology. The book that I would recommend it's called as Linzowski. I'll give the link to the book in the description. It's a very expensive book. Please don't buy it. Get a hold of a ebook or from someone, and maybe print it. I got it printed, or like that. It's a very expensive book. I think it costs around 14,000, 15,000. You don't need to go spend that much amount of money. Get a ebook. So it is especially for those who want to go into hematology and oncology. I think Lanzowski's Manual of Pediatric Hematology and Oncology is more than sufficient. Well, I cracked my exam using that book. My notes are available on my store. You can buy them if you want to go look at my notes. They are made all from Lanzowski and hematology. Like I made notes from Lanzowski hematology oncology, and then I started from them, revised them, and bam, I cleared my exam in the first go. The second topic that I wanted to cover upon, that was nephrology. As far as nephrology is concerned, there are two books. Just wait for a second. If I have them, I'll show you. One second. Yeah. So these are the two books for nephrology. This is Pediatric Nephrology by Dr. Arvind Bagga. This is also Protocols in Pediatric Nephrology by Dr. Arvind Bagga and Dr. Aditi Sinha. So this is a book if you want to go in depth, like घुसी जाना है, or if you are really interested in nephrology, if you want to do a DM in pediatric nephrology, or let's say you're someone who wants to do DM in adult nephrology and wants a good pediatric nephrology resource. This is the book. This is the gold standard. If you're preparing for exam और जल्दी से एग्जाम निकालना है तो जो कुंजी कहते थे ना हिंदी में, the guide book, the review book, protocols in nephrology is like that. I'm sorry. So the thing is that ये ना इसका कंसाइज वर्जन है टाइप से. इसमें ना पैथोफिजियोलॉजी बहुत अच्छे से नहीं दी गई है, बट मैनेजमेंट एंड हाउ द डिजीज प्रेजेंट्स बहुत अच्छे से दिया गया हुआ है. पैथोफिजियोलॉजी के ऊपर ज्यादा फोकस नहीं है प्रोटोकॉल्स एंड पीडियाट्रिक नेफ्रोलॉजी के ऊपर. सो इट्स गुड इन अ वे बिकॉज हमारा एग्जाम के टाइम पे दे डू एंड अप आस्किंग अबाउट मैनेजमेंट रादर देन पैथोफिजियोलॉजी. सो उस सिनेरियो में अच्छी है, बट एक बेसिक अंडरस्टैंडिंग से ऊपर तक आने के लिए बुक उतनी अच्छी नहीं है. इन सच अ सिनेरियो द पीडियाट्रिक नेफ्रोलॉजी बुक इज द बेटर. Then coming to NICU. NICU may people read Cloharty. You have to read Cloharty, at least some topics. The one book that you have to memorize is the NICU protocols, AIMS NICU protocols. There is no two way about it. The third book that I wanted to emphasize upon was the PICU protocols of AIMS. उसका actually में नया edition आया है. I have the old edition. Just one second. This is the old edition. This is pediatric ICU protocols. So yeah. PICU protocols होने चाहिए. तुम्हारी आधे क्वेश्चन, नॉट आधे, बट या 20% ऑफ द क्वेश्चंस विल बी इमरजेंसीज एंड दे ऑल कैन बी सॉल्व विद द हेल्प ऑफ दिस बुक कॉल्ड एज पीडियाट्रिक इंटेंसिव केयर प्रोटोकॉल्स ऑफ एम्स. नाउ कमिंग ऑन टू पीडियाट्रिक पल्मोनोलॉजी. पीडियाट्रिक पल्मोनोलॉजी के लिए अगर तुम्हारा इंटरेस्ट है, लॉट ऑफ पीपल आर इंटरेस्टेड इन PICU एंड पीडियाट्रिक पल्मोनोलॉजी, देन एक्चुअली में डॉक्टर काबरा की बहुत अच्छी बुक है दिस बुक. इसको पढ़ सकते हो. मैंने सिलेक्टेड टॉपिक्स पढ़े थे. इसके अलावा अदर बुक्स दैट यू कैन रीड एंड कंसिडर फॉर सिस्टमिक स्पेशलिटी वाइज, वन इज कार्डियोलॉजी के लिए पार्क कार्डियोलॉजी. लेट मी जस्ट शो यू वंस. देयर यू गो. दिस इज द पार्क कार्डियोलॉजी. लेट मी बी वेरी क्लियर अबाउट दिस. मैंने सारी बुक्स नहीं पढ़ी हैं. मैंने सिलेक्टेड टॉपिक्स इन बुक से पढ़े हैं. दीज बुक्स आर रिक्वायर्ड इफ यू आर स्पेसिफिकली प्रिपेयरिंग फॉर दैट पर्टिकुलर डीएम and you're preparing for INI CET with in mind rather than NEET in mind. I'll be very blunt about this. देख NEET क्या है, पूरा जनरल पीडियाट्रिक्स पूछेगा, पूरी पीडियाट्रिक्स पूछेगा. कुछ ऐसा नहीं होगा कि तुम्हें पीडियाट्रिक हेमेटोलॉजी ऑन्कोलॉजी करनी है तो हेमाटोंक के क्वेश्चन ज़्यादा पूछेगा, ऐसा नहीं है. बट अगर मान लो तुम्हें पीजीआई में पीडियाट्रिक हेमेटोलॉजी ऑन्कोलॉजी चाहिए, एम्स में हेमेटोलॉजी ऑन्कोलॉजी चाहिए, या फिर से पिकू चाहिए या निकू चाहिए, तो एम्स के क्वेश्चंस में क्या होता है कि वो सिर्फ उस सब्जेक्ट से पूछते हैं. तब तुम्हारा फोकस एंड तब तुम्हारे स्पेसिफिक लर्निंग के लिए जो बुक्स हैं वो ज़्यादा वो वाली होनी चाहिए. तो बेसिक बुक है वो तो नेल्सन ही रहती है. अगर नेल्सन तुम्हें टफ लगती है देन ऑब्वियसली पीजी टेक्स्ट बुक ऑफ पीडियाट्रिक द इंडियन रिप्लेसमेंट फॉर दैट. अगर इन दोनों बुक्स के अलावा जो मैं बुक्स अभी तुम्हें रिकमेंड कर रहा हूँ, दीज आर स्पेसिफिकली या तो तुम्हारे उस सब्जेक्ट में इंटरेस्ट है कि तुम्हें लग रहा है कि चलो मैं थोड़ा टाइम है, मैं इसको सब्जेक्ट अच्छा लगता है, मैं इसको थोड़ा ज़्यादा पढ़ लेता हूँ, और यू स्पेसिफिकली प्रिपेयरिंग फॉर डीएम एंट्रेंसेस. For example, if you're preparing for PICU anywhere, you have to do PICU protocols, but ये एक MD को भी पढ़ करनी है, ये अच्छी बुक है. If you're preparing for nephrology, then ये वाली बुक तो करनी ही है. पर अगर MD लेवल के लिए चाहिए तो even this book is sufficient. Similarly, कार्डियोलॉजी जो है, पीडियाट्रिक कार्डियोलॉजी जो है, नेल्सन में डिसेंटली अच्छी दी गई है. But let's assume you're someone who's interested in pediatric cardiology or even adult cardiology and you want a good pediatric cardiology resource, then Park is a really good book. Similarly, as far as neonatology is concerned, neonatology के लिए you have to do Cloharty. करनी होगी Cloharty, तो पढ़ लेना. It's a good book. At the same point of time, AIMS NICU protocols are the gold standard. वो तो पढ़ के एग्जाम पास हो ही जाता है. Especially और AIMS का DM निकालना है तो डेफिनेटली AIMS के NICU प्रोटोकॉल से ही मैक्सिमम क्वेश्चंस आते हैं. So these are the best resources as far as pediatrics is concerned. Now I'll do another video as far as how to read pediatrics during pediatric residency. मतलब 3 साल होते हैं, कब पढ़ना है, कैसे पढ़ना है, कितना पढ़ना है, मैं उसके बारे में एक अलग वीडियो बताऊंगा. These were just the books about as far as resources was concerned. Hopefully you enjoyed the video. You can obviously check out my notes related to pediatric hematology oncology. They're in the description. If you're a pediatric resident, I'm sure you'll find them helpful. Thank you and have a nice day.